Or what I'm chewing is nothing but these ginger honey chips. Ginger honey chips. Now in the United States of America, everywhere you want, 862-215-2007. You can chew it like this, or better still, put it on your cocoa, rice water, oatmeal. You can put it in your akpatashi, your whiskey, your brandy, anything you want to put it on it. It's so nice. So nice, nice, nice. Oh my God. Ginger honey chips, 862-215-2007. 862-215-2007. It's your ginger honey chips. Get one for yourself. $10, free to go. Enjoy yourself. Thank you. I hope you can hear the sound of what I'm chewing. It's nothing but these ginger honey chips. Ginger honey chips. Now in the United States of America, everywhere you want, 862-215.
Now?
Yes, we can very clearly. It was a bit muffled, but I think we can do this.
Hey, muffled?
Yes, and muffled. We can do this. Good morning, thanks for joining us.
Good morning, Koku. How are you?
I could be better. I heard what is very to say.
By the grace of God, we are doing better. We want to do more than what we have done so far. We are believing that we will be able to fulfill the purpose for which our sperm won, because suffering is part of life. Just that we have to look for a new word in place of suffering and use the right word at the right time for the right reason, so we can have the right results. It might rhyme like a rap, but the reality of life is that if you don't want to be on earth, then don't make a mistake to fight other spermatozoa and refuse to become the survival of a story in your family. However, as long as you make this particular effort of beating other sperm or other spermatozoa in your mother's ovary area or the uterus or wherever it was deposited, make sure you make it in life. And remember, to live on earth, you have to be extra patient. You need that gift of patience. If not, you will go early and your death doesn't matter to anybody, even your family. So if you ask me this morning, this is how I'm feeling. And I'm very excited that among all other people, your production decided that wherever I am, my knowledge is still necessary. I pray that even when I die, production will see that I am seriously needed, and you will dial my phone number in my grave, 0277 609 644. Thank you, Koku, for asking my welfare.
Thank you too for joining us. We're trying to see if we can also reach the registrar of the Ghana Medical Association. The understanding is that he's rushing into a meeting, but we can also start the conversation. If he joins us, well to good. We're also trying to see if we can also pick calls from all our listeners. For some of them who have been engaged in, who have experienced some form of, suffering through the medical negligence of the negligence of some medical officers in some facilities, but the phenomenal medical negligence. Again, you have been closer to the field. You have seen things happen. Is it the case that really, there are issues of medical negligence, of course, yes, there are. But in what form do they appear?
Thank you very much. And let me say a cherished good morning to our viewers and listeners. Viewers and listeners on Facebook, on TikTok, on Zoom. Now, in the first place, for you to understand what we call medical negligence, there is a definition in the medical palette or in our practice or in our day-to-day medical activities that when we say medical negligence, yes, people would think it's what do you call it, is an English word. But unfortunately for us, medical negligence, we in the medical side or those who are practicing medicine defines it as the failure to act in accordance with the standard or a reasonable, competent medical person at the time. So let me explain it again. You read a lot of stories that has come to you. I heard you reading them. The issue is that in orthodox medical practice, majority of our activities are general practice. So when you go to a trained gynecologist, you go to a trained dentist, you go to anybody who has been trained under the Ghana Medical and Dental Council or Dental and Medical Council worldwide, majority of the practice are simply the same. So there is a particular act and there are particular practices that are having a particular format or in accordance with a particular rule. So when your diagnostics are given, it's like that the procedure will be the same. And it is said that within the procedure or in the act of trying to save the condition of bringing this to bear, we only say there was a form of medical negligence because somebody refused to do what they are supposed to do according to the procedure. Having said that, we have the procedure including the human being himself or herself that also must be part of the practice. So when the professional in this question does his duty not according to the professional ethics, medical negligence can also be seen in their practice. The same way, if you find somebody who is practicing in the name of the profession and has not been trained, medical negligence can also be seen. Kwaku, there are times that we also come to a point where medical negligence can also be blamed on the patient who has arrived. Because where there are rules in accordance to our practice, there are some clients who, by virtue of the laws governing orthodox practice, the client's rights is very important. Like in Ghana, we have what we call the patient charter. The rights of the patient is very important. So where a patient has refused certain procedures that by medical direction can give them clearance and they refuse, we are supposed to allow them to sign so that they will append their signature to the refusal, that in the quest when anything happens will not be blamed. This is also part of the negligence. One of the negligence I have come to realize, especially in Ghana, is the pride of people saying, I don't go to the hospital, I am fine. They are the biggest problem for us in the hospital, because when they arrive, you have to look for what clinically is wrong with them and we have limited time. Anytime you treat an emergency situation, for example, the tragic department, or when you are rushed to an emergency, we are supposed to clock you and know what is it. Makaku, imagine somebody walks to you and they are aware of their diabetic status, they are aware of their pressure status, they tell you whatever they are going through and whatever medication they are taking. It is easier for you to move straight in accordance to the diagnostics manual and know what could trigger what they are going through. But unfortunately, we have too many people who don't do medical checkup. So the last time they will bring them to you is when you have to fight, and majority of them have been saved. So when it comes to medical negligence, even though it is always a practice within our environment, and we are held responsible because we are supposed to save life, patience could also be part of it. There are others who, by their faith and practice that they are going through, also never want to find themselves even for blood transfusion. For example, the JW people, the Jehovah's Witnesses. So you've seen a tumor that is as a matter of dealing with a particular blood, and you have to deal with it, and you have to, one of the best ways is transfusing when you see person is losing blood. But they have told you they don't want blood. Once they don't want blood, what do you do? Do you get it? So I think that when it comes to medical negligence itself, we should blame all of us. I heard of a guy, the guy said he went to Kolebu Teaching Hospital, and something was on his forehead and they didn't do well. Is that what he said? I wanted to hear that story well.
Well, yes, swelling on my forehead, I went to Kolebu for surgery. The doctor and nurse were joking with me, and we admitted some medication used had expired. Some of the medication used, they said they admitted that it expired. After the stitches were removed, the swelling came back. So he rather went to Yahoo, and from what the narrative was, is as though the things were not done well in his former place at Kolebu.
Well, we can't challenge these because it is part of the practice that we do. However, if you come to meet a nurse and a doctor and you say they are joking with a swelling on your forehead, what do you call joking? Because nobody goes to work to go and joke. But you see, some of these statements, which will not be investigated or verified, could also trigger a particular mental medical negligence. So you see what he said. I went to Nyaho and I met a more senior surgeon, and this is what the surgeon said. Let it be on record. The majority of the people practicing in all our private hospitals, they come from Kolebu Teaching Hospital. Only few might be trained even from outside. Even still, nobody practices well without passing through Kolebu. So if you go to Kolebu, it doesn't mean you can't meet anybody who will not practice well. However, this should be investigated. How can a nurse and a doctor use an expired drug? And what do you call an expired drug? Because in the medical corridor, a drug that you can see expired on the 13th of October has an expiration period that cannot be used. Some have a window of 3 months, some have a window of 6 months for their efficacy, not for them not to lose their efficacy, or not to say it is no more potent. So the fact that maybe you saw that a drug or during a conversation, they said the injection we have here is expired. You might not know the finality of what it is. We are not justifying. But these things make others not even to go to the hospital at all. And before they bring them to you, they are rushing them in a position where you can't save the condition, and you are told that it was as a result of the negligence of a practitioner. But let me tell you, especially with Kolebu Teaching Hospital, which is a teaching hospital, if you follow the procedure before a patient will walk to the place, it's a teaching hospital and it's supposed to be, in quote, one of the biggest and the last stops for all other clinics. However, it is not so. When people are not managed well down there in our various clinics, various private institutions where people believe and that the environment alone heals them, except the environment of Korle Bu Teaching Hospital. Before they rush them in an ambulance to the place, it is where they have 30 minutes to die, or 30 minutes to lose their life, or 30 minutes to pass out, or to go into danger. Then you have to force and save them. Majority of people are saved more than those who come to pass out there. But because the mind people are giving wrong information, or one bad act makes people lose confidence in the system, it's part of the medical negligence. But the things that are done in Korle Bu, the lives that are saved, because you have a patient going to a private hospital, the BP is not being managed properly as a pregnant woman, and the patient might be released to us by the 6 months before anything is done. Then you see the patient being rushed on the 8th or the 9th month, the last week, to the hospital. And you see a record given, a huge record of they seeing the patient for a number of weeks and realizing that this is eclamptic, this BP is up, this is what, they will not bring the patient to you. We are not blaming anybody. But in the last minute they rush the patient, they expect magic to be done in the hospital. Magics are done. But the negligence at time doesn't happen, because every time you see your obituary, which sad event occurred at Korle Bu Teaching Hospital, please come and check. Where did the patient come before the sad event occurred? Some have brought BID, but they still write sad event occurred at Korle Bu Teaching Hospital. So some of the negligence in the minds of the people are caused by the people and by some of the records that are not investigated. This is not to hold brief for any hospital. It happens to range. But I'm talking about Korle Bu because the person said he came to Korle Bu and the surgeon was not done properly, and he went to Nyao and it was done properly. I will not challenge him, but there might be something beyond what he sent to you, my brother.
See, the case of this man, very soon the front we could have some people join us 0302208080 0302208080. If you can share with us what your experience has been, if you have had anyone, lose anyone, or use any people itself because somebody is negligent in one of the facilities, please share with us 0302208080. 2 minutes after receiving injection, the boy dies.
So let me say this. 2 minutes after receiving injection, the boy dies. This is a claim from who? Because that is why I want to repeat this here again.
This was angry at something because we see we are fair share of electronic attacks from illness, only for him to leave the ball, and then because in 2 minutes after, I get to them.
Your line was not clear, but I wanted you to say they received their what?
A fair share of attacks, electronic attacks. I mean, he lambasted them.
Why will a nurse do that?
The nurses who are very disrespectful in this country.
And they are patients who have never reminded themselves that they are patients. Let's not think that nurses are robots. Let's not think that doctors are robots. There are some clients who works to you in the hospital and they are too disrespectful. A nurse is not a magician. If you are asked to go and buy a drug so we can inject your son in the next 22 minutes, and you are not able to provide the drug in the next 22 minutes, you expect the nurse to wait for you not to treat the next person? So I don't know what really happened, but I'm saying we are not defending negligence. We are not justifying negligence, but we can inject a boy and the boy will die in 2 minutes. The cause of death.
This is what it is, right? Recounting the ordeal, the mother deceased, Mrs. Nelly, news to the DNA that she took the deceased who was on an asthmatic patient to the facility nebulizer, right? On reaching we went on to the pharmacy unit. I was directed to the emergency ward, which is red light. And the unit, misunderstanding ensued because Michael was asking the board to be located at the emergency ward. We were directed to come.
So somebody gave you a verbal direct. You went to the pharmacy unit with your nebulizer whilst your child was asthmatic. Is that not it? And you know, and you thought that the best place to go is the pharmacy unit. So you went.
We asked them to go to pharmacy unit. Pharmacy unit also says, Charlie, this is by way of emergency. Go to the emergency ward.
Okay. So now the first question is that why were they directed to the pharmacy unit? It means that they needed to buy a drug for the nebulization. Because pharmacy unit, you only buy drugs. Is that not what the issue is? Well, maybe they were not giving prescription, or because if you walk to any of the pharmacy units within the hospital level and you mention a drug, nobody will serve you until your prescription. So the negligence could be that when they walk in there, they were handed over a prescription to go to the pharmacy unit and go and buy a particular nebulizing drug, which could bring this misunderstanding. Pharmacy, and you go to the pharmacy unit, and because they are there for an emergency, there are times even at the pharmacy unit, they expect that they should be served first, regardless of who is there, because it's an emergency. Hey, these things happen. However, you got the injection. Where was the child injected? Is it not the emergency unit that the child was injected? Good. So you got it. The child was injected, and you are claiming that the death of the child is as a result of the injection. I will only believe this if the autopsy of the disease is proving that the injection killed. Because it is difficult for you to say an injection that was prescribed for a particular condition has killed the patient. If not, the patient had abscess. Because, listen, I say this to you every day. And that is why I sit here and I've told you before, and I've said it on TV, on all channels, that I don't believe that anybody died because of COVID. Why do I say that? The cause of death and death certificate can only be given for burial permit as a result of an autopsy report. And how many people did we have the courage to do an autopsy on to prove that they died because of lung expansion, lung infection? None was done. Why is it that somebody died in a tragic accident and there's a demand for autopsy to be done before the death certificate is released? So when somebody says the last thing I saw was an injection and that is what killed my child, it is debatable if the person is not giving me the autopsy report that proves that it is the injection that killed the child. If the injection killed the child, will it be because of negligence? What will you call negligence? Was it that the drug was a wrong drug for the asthmatic child? Was it because it was delayed? And it was delayed, will you hold the doctor or the practitioner who didn't have the drug on the shelf, but you need to buy and bring? Because let me tell you one of the painful things. We have emergency drugs that we use, but it has come to the crossroads where even in the practice, drugs must be bought or must be supplied for us. You, the practitioner, if you use a drug that must be paid for and you don't have the patient paying for it, you are supposed to pay. That is how far the punishment the practitioner goes through. So when a patient comes and the drug is supposed to save them according to your practice, get me XYZ Lumo, and the patient doesn't have the XYZ Lumo, you do your practical ways of saving. I'm waiting for the drug. Some time ago, gloves, hand gloves that we use. Every patient comes and they are supposed to buy their gloves. So when you go around them, you use their gloves. It is in a whole package for them. Can you imagine, Akoku? When a nurse is going to a second patient who doesn't have, so picks up the first patient's gloves to use for a fellow patient, it becomes a, and I'm a daho, me just said, let's me gloves, you know, I'm not the thing. So the ball cannot be put just at the practitioners. Can you be thinking of governance? Can you be thinking of those who are supposed to be supplying? Can you be thinking of those who are supposed to give facilities so that negligence can be avoided? It is unavoidable. And in some cases, it is avoidable. But in this case, an injection killing a 2-year-old child, it is debatable. if this particular autopsy report is not the reason for the cause.
19-year-old though.
19.
19-year-old.
Is it 19 year?
Yeah, level 200 law students at the University of Ghana.
Yes, it's a good story. But what injection? Will injection kill? Others are taking the same injection. If the negligence is that he was supposed to be injected with XYZ injection and somebody gave so and so injection, that could be the reason why the person died, or was a delayance. Was the delayance caused by the hospital or by the purchasing of the drug for the nebulization? And is this report coming from the pathology department giving us the confidence that by the autopsy, this is the results, that this is what killed? And it helps us. I tell you every day that what will kill you, you don't know until you are a dead body. Why? Because it is a report from the autopsy department that tells us what killed you.
I think this one says concluded proper nurses are the ones leaving the system. Most of the rest are the protocol nurses. Okay, counselor is right about but in Kolubu, there's medical negligence in Kolubu because my ex-wife had a big baby, and there was evidence. She had to go through cesarean, but a doctor wanted her to deliver normally, and she could not abandon her. Okay, I'm not getting this. I was in court 6 of 15 High Court, and this case came where a footballer had issues with his left knee because, but the doctors operated on the right knee, which had no problem, and this affected his ability to play. A man of the best sell spare parts in a Busol car, so he says, okay, he was working in court where a footballer had issues with his left knee, but the doctors decided to operate on the right knee, which had gross problems.
Well, let me say this, and I keep saying this and I'll repeat it, that we are not defending any form of negligence. However, we are educating the public about avoidance of negligence as a result of some medical practicing or some clients or patients that comes. These 2 stories you have read. I lost my wife because my wife was supposed to be done. They are supposed to done a CS on her, and then the doctor refused until she died as a result of pushing. Honestly speaking, these things, there are times that the gynecologists and the midwives will have to rather do things against the will because you have a patient who have come rather, whose condition, dilation, and strength cannot push. But some are holding pictures of pastors, prophets, some water, cross, some creams, and they bring it to the labor ward. And they tell you that my prophet says, if they touch me with knife, I will die. So let me push. And under the medical practicing, what you are seeing is that her pushing will cause her to have a Down syndrome child, a child with deformity, or will lose mother. So there are times that we want to see you can't lose mother and baby. So you want to rather salvage baby, lose mother, or try to get both, and when one goes, they go. This particular one, the woman is saying that they allowed the wife to push. I also not come to defend, but the cause of death is what will let me know what he's saying is true or not. Was it there when they said they won't cut? Was there any challenge? Because they have challenged doctors. I personally have done counseling whilst a patient was lying on a trolley to enter into the theater. She said no. Her faith believed that and the condition was bad. Unfortunately, we have to ignore what she's holding, the picture of the man of God, and not ignore per se, because the patient right to makes you feel at times, but the prophet says, she's alive with the child. We did a cut for her. You understand? So, yes, she's lost the wife. My condolences. But what did the autopsy report say? Was there any form of negligence as a result of this one? When the patient is refusing an elective CS, or a patient believes that you can't cut me, because the last time I had somebody was there who has planned for CS. He got to the place and the doctor who has been seeing her in the consulting room was not there to do the CS, because the team to do the CS on her day, The doctors, we have days for the CS. Everybody, any team A, team B, team C. So, for example, the team A doctor was the one who was seeing her, but she was rushed into the place. And the team A doctor surgeon time is Thursday, but her condition demanded. The doctor was not on duty. So it was explained to her politely that it's an emergency situation. Even though Dr. Lumon said he would do it for you, your condition now, his time is Thursday. They are equally competent, Dr. Lutrot, Dr. Kobe here, who can do it for you. This lady said, if it is not Dr. Lumon who do the CS, she would rather go through the pain, lose the baby, and lose her life. I'm telling you.
Interesting.
We called the doctor, and because he was off, he's also doing his locum somewhere. We have to force him. He was also in the theater doing something. All this time, we are trying to manage condition because a patient, right? She's insisting that I want a certain doctor to do my CS for me. But you have been rushed to the place whilst it's not the turn of the doctor. And the doctor was doing his own thing. He was not on call. He was a consultant who was not on call. We struggled and called and called and called and called. And you see, he was doing surgery at that time in a particular private hospital where he goes to do his work. Far in around in Sawam area. Now we have to call him where he finished that case. Then he picked the call. He asked, oh, what is happening? Then we said, Mrs. So and so is here. He said, yeah, that's a patient to take care of. And he's obviously out. So we have to put the phone on speaker and spoke to madam, please. Doctor this, they are seniors to me. They are like this. We work as a team. If I die today, they can do for you. So please allow them to do for you. He says then they have to write a report that anything that happens to them, they should be blamed. Who would do this? That a patient is telling you that, right, that if I die, you killed me because the doctor, and the doctor say, I can't come. Where your condition is now, they have to cut you quickly because you will lose baby or lose mother.
Interesting.
So you see some of the conditions at the place, and we don't come and talk. This is happening within that few time. And this is not a patient who is unconscious. She's hearing what is going on. But when she comes out of the hospital, she'll go and tell anybody, say, doctor's near you. Now, say, you know what I'm talking about? They don't do that. They don't do it. Let me tell you, when it comes to the labor ward, there's nothing like pampering. What do you call pampering? Cannot be. Your husband is not there to say me dog, madam, push, because it's two things. Some will want to breathe without pushing, and that is a serious thing. We want you to dilate. Madam, push. And the push, a gentle push, madam, push for us. Dramatic. Madam, Miss Rao, trusty, not push, Miss Rao, madam. So in that time, you will not like us. But it's like you have a sore. And we want to treat it. We use the hot water. And you hate us, but you walk. This woman I'm talking about, we save her. We save her by one doctor who did the CS for her. But when we finish, we have to keep on going to her because now Ghana is full of, I will sue you, I will sue you, I will sue you. When she finished and she was fine, she didn't even come to say thank you to us. And she didn't tell anybody what went through in the place. I'm the one telling you today.
Interesting. Very interesting. Okay, so we just had lost Councillor Mutual.
I'm here. I'm here. I rather lost you.
Okay, right. I also lost you here. This one says, Coco, I can't remember. In 2004, my mother was sent to Colony for esophagus cancer surgery, and she died. Meanwhile, they assured us that it wasn't anything serious. When we asked what happened, according to investigations, they said it was students who made the surgery on my mom, and they used my mom for studies. It means that the doctors themselves gave my mom to students. Coco, they used my mom on Blackboard, weren't they? And they was really worried as far. This is a knowledge person.
It's not true. This is not true. No, I'm telling you that there is no student ever that can be given the right to enter into any theater in Kolebu. No student. Share what you talking. You know what it means to have a successful surgery? Student, even clacking. You know what? Do you know? Look, it's a teaching hospital, eh? So when people even feel that the bosses there are too much, they don't want them to become qualified doctors. My brother, nobody will give any student doctor rights to enter into a theater to do esophageal surgery. My brother, it is a lie. What was the cause of death? That they use your mother for experiment. How? These are some of the things that we don't come and defend. So every time you are painted as black, it is not true. And I will challenge this person. My condolence to the death of it is not true, please. It's not true. How can we give a patient to a student? Even when you come to the consulting room, there are teams, and there are always more than 3 senior consultants that on their table, whilst and there's a senior resident and there are 2 residents who are sitting in front, and the other people are holding notebooks. They are writing. They are only writing into their diagnostics book, listening to what we are saying. So it's a teaching hospital. If we don't do that, we can't build a student. But nobody will be. They ask them questions. What do you think? When you come and we are going on ward rounds, we all follow like zombies, and the seniors are talking. Morning ward rounds, they are pharmacists, they are nurses, they are doctors, and the students are following. Nobody will give a patient to a student in Kolebu. It will never happen. If a private hospital, we are not there. But our theaters, you can. Who gives you that right to enter? Hey, Master, it's not true.
So if we present the investigation to you, if we try and present the investigation to you, and it shows that students do that,
it will never happen. It's not in Kolebu Teaching Hospital. It will never happen in the Kolebu Teaching Hospital. To get access to do surgery, or someone called surgery, my brother, that they will give
cancer surgery.
Please, it will never happen. Hey, the oncology people, do you know what it means for you to get to a level to go and, hey, my brother, student.
By the way, before we go, the cases are rising, they are surging, and so we need to speak to most of them. I mean, in 2 minutes, what can we say? Please help us with the patients and of course the doctors as well. Remember, there's the exodus, there's the leaving doctor. This is why we made some of them so angry. And don't think that
my brother, as for the exodus of nurses and doctors, it is bound to happen. Even in America and elsewhere, the doctors who are here are practicing because we have medical negligence lawyers here. I don't know if you know about it in America, and there are lawyers who have pinched their camps around hospitals. And it's funny. I went to a certain hospital in a certain country one time. It's funny that I saw these people standing outside and I asked them, what are they doing? They said they are lawyers. And all they are asking is that, do you have anything against the medical practitioners? Were you injected wrongly? Did you delay more than the time they told you are supposed to delay? You know what I'm talking about? So people are too careful here. And that's why a lot of referrals are happening in this place. Number 2, the health, I think that just 2 minutes, I can't solve this thing. Maybe God willing, if your production will give us how to solve this issue, because some of them are governmental issues. Because if you walk to the US, for example, your medical insurance doesn't cause any doctor to rush, as in the word rush, to do something for you, because it's not about cost. Once your number, your social is there, and you are clear with your medical insurance people, the confidence of the practitioner to write a certain drug that you can get is simple. Do you know where I'm coming from? So when we are expanding this conversation, the government must also be brought into the picture. The patient must be brought into the picture. Information dissemination must be brought into the picture. Like what you are doing now. simple must also continue. For example, in Ghana, people believe that my sister died because we were calling ambulance. We all know the policy right now. If you call an ambulance, you need to pay for diesel. Yes. And so when you call me, you say Kwaku is dying or Kwaku is sick and we need to rush Kwaku. Well, remember that ambulance doesn't pick dead body. So when you call, with even in the whole world, they will ask you the condition, the state, because the type of medical team we are bringing. But somebody calls me, I've gone to do a research in the ambulance center. Me catch us every man who be something quasiasem there will be some no everyone will nyankwa me see nipa in the home to me but to bona catch ye hu de dey ba owu radio station but as if to say that we are being punished. So tell me, what if it's hypoglycemia? I know what you can do in a minute. Before, you know why my foundation is dealing with asthma and diabetes before the cerebral palsy? Because my system is teaching people how to do basic things before you take a patient to the hospital. As solutions, we can't do all here. But I believe that maybe if your production will do, next week we'll do solutions. But a lot of people are the cause of their own negligence. But because the bus stops with a medical practitioner, especially Kolebu Teaching Hospital, the majority of the obituary is which sad event occurred at Kolebu Teaching Hospital. People believe that Kolebu is not giving people life. But if there's anything in this 100-year celebration of Kolebu, people are alive, not because of any practicing private hospital in Ghana, but it is Kolebu Teaching Hospital. Let me say thumbs up to all the people who are practicing there. And as for the exodus of nurses and doctors, we can't stop it. But the more they go, the more we raise new ones. And the new ones can still take good care of us. If you have any challenge or any problem, yes, go to radio station. But please go with the right information. If you're also listening to me or watching me, you're going to a private hospital and the practice is not too much, but they are interested in the money because they have to pay their bills. You can please request and bring yourself to where the cost is subsidized, but the practitioners there are solid and better, especially like Kolebu Teaching Hospital, like Rick. This is not to say that medical negligence cannot be found in these places. It can be found, but because of supervision, majority of the time, it can be minimized. Solution, I think next week, if you give me the chance, we will do it together. My name is Councillor George Lutot. You can call people to need counseling before you go to hospital. Some of the cases are not injection, they are not surgery. On 0277 609 644, I will say you can call me. I'm responsible for my own comment. If I said anything that you want to challenge it, just come to me direct. Don't go to Koku. Koku is a fine gentleman with a beard, married to just one woman. And I am married to 3 women, and I can meet you boot for boot on 0277 609 644. Kwakulumo, thanks to the president who went to your hometown to speak the truth. And I was trying to listen to you this one. It didn't go through for you. Pay me, Papa. That Nanado spoke the truth, and all of you say why.
Oh, I saw that yesterday. I don't have any problem with that idea.
But the truth is that did you people vote for him? No. So he came there not because of your vote, because it's election time. I want to grow and be like Nanado Dankwa Akufo-Addo, that can still speak at that age. Kwaku, thank you for having me. Thanks to production. And where's my doctor friend? Where's my sweet doctor friend? Dr. Sir, where is he? I would love him to come and share. I mean, we are suffering. We are suffering in the hospital. Some patients are too low, especially those of them who have gone to school small. And I've read on Google their diagnosis. When they come, Charlie, they want to treat you like you're some small boy. What car do you drive? As if doctors and nurses are poor. You know, that kind of mentality. Doctor, Charlie.
Thank you. That's Councillor George Lutot. Ensuring answer. Next time, I hope to get some education as well. We're going to be bringing Mr. Divan to the studio as well with, of course, Councillor Lutot next week, so we can have a good conversation. There are some questions here we have deferred to next week. I will answer all of them right here, so you want to stay with us. This is a new one coming in from the camp of Sharawale and Techno. It's called Incoming. It's called Incoming.
All right, so thank you very much. The rest of us who are here, we are done with class class FM in Ghana, and I think that now we can deal with Councillor Luttrell here. Just a few minutes. You know, it's not part of our things, but when Wednesday we have anything to do, let me say thank you to Abna. Abna Sugar, thank you for being here for me. I saw that you've come early. Unfortunately, I was not able to pick you to talk, but we are discussing medical negligence, and we'll continue next week. Eric Azuma says, I'm just loving your delivery right now. Very powerful and educative. I'm a medical lab technician. Oh, okay, that's good. So we are back to the conversation table. Can we please this 1.2 things? Look at all the things I said. 1.2. Why 19 people? This is medical negligence. Who should be blamed? Who can we stop medical negligence? And Facebook at this time of the day, this level of lecture at the CSA, you have just about 4 people who are watching, thanks to Bismarck and thanks to Aram who has come. What I'm saying, come and learn something so that you don't give your life to wrong people, or you don't. Oh, why do people do this to me? Please, I will always compare myself to Agrada. Why do you like fight and quarrel, which is educative but less educative? This is medical. This is medicine. And I won't pay school. You want us to come and fight, insult each other? Is that what your expectations are? No. Knowledge is power, and we are learning. Even in America, I went to a particular place. I can't mention the name of the hospital, but I saw people study, and I was asking my friend. Now we hear the one. He told me a lawyer, so yeah, picky cases. So right now, even delivering in America is not easy for you to be cleared. You know, because of infection, people suing people. But in all these, we still have Down syndrome children. We still have children who have challenges as a result of lack of breath, and so they end up becoming cerebral palsy children. Yes, I'm telling you. We have hardworking nurses in Ghana. I have my sweetheart there, Jane, and I'm Santua. She works, and at times I ask, what is wrong with you? Even with her peanuts, a young lady who is building her life, she uses all her salary for transportation. Because there are times that there's a particular matron who has refused to understand that let nurses live within their community if you can't give them, what do you call it, a flat to live in. The protocol is that they are supposed to have flat to live in so that they will not transport themselves far or give them shuttles. It doesn't happen. The public was complaining when we're giving doctors, nurses, and paramedical staff clearance to get car. They said, why should it be so? Companies bring cars and they bring to nurses to pay little bit. They stop. The government was giving waiver so you can get a car to transport yourself. The government is supposed to give you every 21 miles. The government is supposed to give you fuel as a medical practitioner. It is no more happening. And a doctor for pesca and a nurse is pesca. Nobody, look, when you go to a facility, and you rather introduce yourself by virtue of, or by your card, they know you are a doctor. They want to give you a higher price because they believe that you have more money. This is just for a joke. So a friend of mine, who were talking, and they say, "Mu doctor for the mupemba amumbrekra." I say, "Mu di dini ko I am a doctor." No more say share. When a lady gets to know you are a doctor, or the iPhone 15, or the rent, or the mame yale, or to a say. So doctors rather go to chase girls, not with their titles. They go and say, I'm a farmer. I'm a struggling person. Because when they know you are a doctor, you give more. It's as if once they know you are a medical person, you should have more money. But it's not so. For example, I walk to the hospitals in this place and I talk to people who are in America. You have a biomedical clinical technician who doesn't take care of all equipment, but they are just on X-ray machine. suction machine. Most of them, the amount of money they are paid and their insurance cover and health cover. My brother, if they tell you it is 5 years, some are 5 years salary of your 1 year salary. What's it gonna say? Nipani 1 year salary. No. Ejuma wo ye wo Kolebu 37 Rich Hospital. E ya kwano wo 5 year salary ni ya kwano 1 year salary. Because when they increase your salary, even people in Ghana begin to make noise. And a doctor said, Dr. Bakuji say, but what we do to bring you back alive, it's difficult. So when people are saying that negligence, this is a hard truth. The government is doing his part, but he can't do all. I saw a video of Prophet Odro saying that the leaders are sick because when they are not well, they fly them to America. But where should they fly them to? Where should they fly them to? If you don't have what it takes to take off a big man sickness needs a big hospital. So I didn't agree with Prophet Odro. Nana Dodongo Akufo-Addo. He uses the X-ray machine, he uses the MRI machine in Ghana. But for security reasons, we can't put it out there for you. But if whatever he's going through is not okay, and Nana came to power whilst he was going for his medical checkup already in America. So you say because he has become a president, his medical record in America, he should stop it and start being taken care of in Ghana. And what condition he's suffering from, a sickness of a big man needs a big hospital. Listen, I went to school in China, and when they are looking for your vein to transfuse, like what we do at the lab, tie and what? There is a simple vein scanner that they put it on the neck, and the cannula is able to position and enter gently. Simple. We don't have some. We don't have some. But we are saving lives. How many people are donating to the hospital? What's the name? Canada, Japan. Single-handedly built a cardiothoracic center for 37. For Sekwari, despite they say they are doing their best. But none of them in a condition, Kennedy's medical review is in America. He was coming here already for his medical review in America. So you can't say, I don't know about America, I have a show. Say, would you Ghana dear? No, it doesn't mean the practitioners in Ghana are quacko, but they before they became who they think they are, they can afford. And this is not to say that Ghanaian doctors are fake or they are no, it's not true. Our doctors are okay. They save serious. Listen, there are people who have left America and they've come to Ghana. They've left UK. They've come to Ghana and they are in crisis situation. We save their situation before they come back to America. I know people who leave America to come and do surgery in Ghana. Yes. Yes. I have a case of a spine injury in America. And because of some insurance issue, because nobody wants to be blamed, everybody is doing it gently. She's a Ghanaian. She came to Ghana. She's driving again. I have a case of a 3-year child, a cerebral palsy child that was born from birth. And you can't say it's negligence because the size of the baby, if you go and study what causes cerebral palsy, then you can see that there are most of the times that 60 to 65% could be when at birth. When baby is being received, you can easily get a cerebral palsy child. Lack of oxygen to the brain, and at times it's because of stress, fetal distress, where the child is due to come. But so it's some 65 to 70% are negligence or delay. Cerebral palsy children. They are more friendly in Suban. These are hard truths, and let's say it. Now watch it. I'm not talking about a Down syndrome child. I'm talking about cerebral palsy children. This young gentleman who was delivered by a woman who was energetic, finished, and the child had signs and symptoms showing that the child is not okay. Lack of oxygen to the brain as a result of delivery issues. So the medical facility saw that yes, some negligence occurred as a result of delay. What did they do about it? They delivered a child and told the woman that per what they are seeing, the heart rate and whatever it is, this child can only live beyond 3 years. Yes. So the mother said, okay, I hear. They started physio. You know what the mother did? The mother discontinued the physio in the hospital and started in Kuto, shea butter and olive oil at home. Started by force speech therapy. I am talking to you. This child that they claim would die at age 3, he is 33 years man, active, to the surprise of the medical facility. Say if you do money, a jacqueline can't go. Negligence kana ombetua near castle. But I cream, but shank while I live for a number. What did I gonna say? But shank while I live for a number. So medical negligence, and you're gonna for Yali, and then you're gonna for doctors, nurses are before. Yes, we have nurses and doctors who might have some attitude that, sincerely speaking, is irritating. They do even us, we do it to ourselves. I'll say they do it to me. We do it to ourselves. So you come to a hospital like Kolebu, a nurse who is not on duty, see the painful thing, has the child sick, and she's dressed in jeans and top. She will not bring the child in jeans and top. She will wear uniform because the uniform gives resemblance for better care. You know why? Because we, those practicing in the hospital, we don't have better health care. My friend, the wife works at Graphic Corporation. When he's sick, Graphic Corporation takes good care of him because the wife works there. When the wife is coming to deliver, she's given the opportunity to choose the highest service in Kolebu. Me, Kolebu worker, health practitioner, saving lives in the hospital. When my wife is coming to deliver, if I choose the highest place in the hospital, I need to pay. Even under all these conditions, we are saving lives. So you see, this negligence thing, and I'm telling you, some of the times, oh my God. Look. We have to manage the conversation. So the health practitioner and unless be a Dr. Sinyako, let's stop the exodus. We'll stop the genesis. We'll stop the genesis. They should leave. But when they leave, won't die. We have others who will continue their service. But how are you working for 20 years and you are leaving the government flat and you use your salary to go and roof your house in Kaswa? You use your pension pay for roofing. You work 30 years and you are leaving the hospital and they are doing end of year service for you award. They give you polytank You are sick in a hospital, and they say there's what we call Medicare. Recently, I hear Kolebu is trying to put some Medicare thing around. And the Medicare is so irritating that there are limitations to the Medicare. It's not full cost recovery for medical practitioners, paramedical staffs in the place. You pay. If you don't have money, you would die. And your colleague who works with cocoa, they've not planted cocoa before. The only thing they do is that they work with cocoa board. They don't have a farm. You meet them and they work in a hospital with confidence. Every drug written is supplied. Look at the face of a doctor and tell the doctor you need to register with the health insurance scheme. And now all these conditions, people are still working with their heart. So let's learn to appreciate our nurses and doctors. Let's appreciate them. When COVID came, you saw what happened when COVID came. The promise they gave, the frontliners, we're going to get this one. The money didn't come. It was across board. Some had till today, others have not gotten it. But we are still working. No incentive to improve your happiness and excitement as a medical practitioner, as a paramedical staff. The cleaner in the hospital, if you come and see an OD in the hospital, it's painful. The fact that an OD in the hospital cannot read and write, what they do after every surgery, you can't clean the floor, you can't mop the blood, you can't carry the amputated things. It is this oddly who is not educated. You call him the common cleaner whose salary is so mean, is so insulting. Who does the cleaning for us? If they don't clean, we can't enter there. And when they are sick, some of them have to afford. And the funny thing is that they say pay and later they will pay you. If you have the money, why will you? Under all this condition, they are still doing well. Every midwife that goes on retirement, I know, ends up with spondylosis. You have a serious neck problem. And when you check the condition, it's because they did delivery in wrong positions. Oh, yes. Yes. Because the stirrups on the delivery table, the movement of the delivery table is not moving up and down. Because under normal circumstances during delivery, positions are changed. The height of a patient, the height of the midwife. So there's the table for delivery it's not the same thing. But it has come to the crossroads where you don't have constant replacement of your delivery table. So the delivery table we have right now has been set in a lock position. So instead of the nurse to stand straight and pull or bend in a certain angle, her height cannot be adjusted. But the baby must be alive, mother must be alive. And these are some of the challenges that a medical practitioner will go through to let you have a baby. And when you leave the hospital, yes, you insult us. If I give access to people to tell you nurses, and it's painful, as for the nurses, I pity them. Because when you're so a nurse, one of the family members of mine is a midwife, and she works with a hospital, and she's fortunate that she was able to go and write. She was able to go and write this ITEL whatever examination, and has left to UK. Now, fortunately for her, when she was asking permission to leave to UK, the matron in charge refused. to give her all the clearance. Even while she was working, the matron in charge kept on treating her. She just called me and said, come and see. I had opportunity to go for an interview in an agency. In the queue, the matron who refused me and was shouting at me, I saw her in the queue. I said, wow. I called her Auntie Maggie. Says, hey, me a matron. Say, here too. She's also left. Yes. Look, COVID. This community health nurses, they fought them. Even now, as I'm talking to you, they're supposed to do COVID mop injection. They will walk on the sun their whole day looking for people to inject. And the government is giving them the whole project they are doing for 1 month, 2 months, 8 weeks. They are giving them motivation because they say they will pay them salary at the end of the month of 360. Out of the 360, they take taxes. They will work and they are giving 160 Ghana cedis after that 8 weeks of working on the sun. During the COVID time, one of my sweethearts, we only thank God she didn't get COVID. And she could have got COVID, our family could have had it because she goes and comes. Like me, it got to a time that I got pissed off with the test. Because I just go in and say, we have been exposed. Because where I work, it was highly. I don't believe COVID till today. I don't. Yeah. I don't. Maybe I had it. But they realized I don't believe in it, so it didn't. Or maybe I was constantly, and my chips was constantly in my mouth. And I heard COVID was afraid of ginger honey chips. Fear and panic. We did lifetime service during COVID. There was no off day for some of us because of where we're working. And nothing came out of it. Thanks to Nanado. Not because Nanado is bad or good, but thanks to he's the president. They just organized some program recently and honored people with certificate of honor for their selfless service rendered during the COVID with no money. Nanado's tenure of office, they've come. Waiver for cars have been cancelled. I can't remember the last time that a medical practitioner had waiver. Look, our what do you call it? Car maintenance allowance. 150 Ghana cedis a month. Car maintenance allowance, 150 Ghana cedis a month, can be piled up 1 year. So you shouldn't drive to 1 year. These nurses will walk, no snack, nothing, with insult. So when they have opportunity to come and do the same work with a lower degree, will they sit with you? I meet colleagues who have studied the same thing I've studied. I come and meet them in America, and their salary for a year is 5 year, 8 months salary. My 5 years, 8 months salary is what is my guy is taking here for 1 year. But I'm still there working. Then a patient will come and insult you. When a patient loses their life, it becomes a big bombshell for us. When the patient recovers, we are very happy. We expect that when you go to places and you see your complementary card and realize that you work with the health sector, somebody must appreciate you. But they rather, maybe somebody, maybe I pana many biena enemy ako kolbupa. Mesa sorry abefi Jimmy Sem and Kwasia Sem. And Kwasia Sema Kofama. Medical negligence. When was the last time you went for medical checkup? You don't go for medical checkup. You don't. Maybe because you're in America, it's a must. Oh, yes, it's a must for you to go. Some problems of somebody says some problems of insult to we Sierra Leoneans nurses. I don't understand. Come back again, I'll read it for you. My able nurse, how are you, boy? Yesterday I was telling people that a certain lady has put what tear your baby doing and say a Jumana say we are one.
I heard you. I was at work.
That's good. Yeah. So this is a male nurse who has done well. The government even recognizes his services and took him to Barbados. He's back to Ghana. He had opportunity to go to UK. He left to Ghana to go and be working for £20 a month instead of £20 an hour. And you go and meet such a guy in the hospital. you won't appreciate him. Selfless work. I remember my wife was delivering and they needed cytotech, yes. We had none when my wife was rushed to the theater. Then there was a colleague who works in a private hospital and had some. He insisted I give him the money before his use of my wife. Yes, I'm telling you this, I've never forgotten. Yeah, that's how painful it was. And it wasn't I didn't have the money, but I was not there. Listen to me. Patients are going through to anesthesia for surgery. And I'll let you speak, Bismarck. And whilst they are on the table being prepared, they are asked for the money for the anesthesia drugs. And when you say, my brother will pay, they'll say, no, we need the money now. They take the money before they anesthetize you. You know why they do that? Not because of their weakness. The drugs are not under the health insurance. And the one who supplied the drug is waiting for his money. And you, the anesthetist, who is anesthetizing the patient for surgery, if the patient doesn't pay, you are asked to pay. Well, somebody is reading. I'm sorry, Abna earlier. I don't know why Abna is going to hide. So I have to force and read some of the things for you. He says, Abna, what are candy? Whoa, Abna, girls prefect. So he says, please, some doctors too, they should tell us what to do after surgery. Now it is not good crap. Abna, you have to come and explain that one, because after surgery, there is no, from where I know, that's why I define what medical negligence is. The medical negligence is we practicing not under the code, according to the medical practitioner's manual. So after surgery, the type of surgery you do, before you leave the hospital, you are taken through a routine conversation. And majority of the conversation, they are not done by the doctors, because the hospital belongs to the nurses. So when we finish with surgery and from recovery, you are taken to the ward. You are told what to do when you get home. If the stitches are not dissolvable, they tell you don't go and bath. They tell you don't go and use hot water. And this is not supposed to be told by the doctors. Majority of the times, when you go for review, whatever has been done for you, then you are told what you have gone through. For example, we are going to do a myomectomy for a young lady. And the young lady is a very beautiful girl. So she loves her tummy. And the position of the myomectomy, what you call fibroid, yeah, the position, when you do a bikini cut, you cannot go for the myomectomy, because per the scan, it is a size of 7-month-old child. And there are other organs. So the lady was told by the doctor that I am likely to do a vertical and horizontal cut, so I could reach the myomectomy and still leave your organs intact as a young lady for delivery. She doesn't understand it. A friend was giving a bikini cut neat. Your own is not like the friend's own. And you are bleeding constantly when you are menstruating. Yes, it's an inconvenience. Yes, he says, can't we do any other one without cutting? This is beyond that one. Your size is too big, can be shrink and sucked out. The doctor is in trouble. So when she finished, she's been told about the cut. Before the cutting will go on when she's ready, prepared. Lucky enough, she was referred to see as a counselor, and I was fortunate to be part of the team. We've spoken. We've gone through series of sections to explain to her. She's not happy. She is not a happy girl for the vertical and horizontal cut. But we want to save her condition. And this is what can be done for her. When she finished and somebody sees her say, hey, nothing out there, what do you say? And yet Dr. No. I believe that she should be able to tell people what we took her through. Look, doctors are equally human beings. Paramedical staffs are equally. Lab technicians are also human beings. The hospital is a teamwork. Somebody came and said, me Dr. Bemo. By your condition, yeah, Dr. Babi and you show condition. Bema never show. Bema show any just a sub you or channel or person show. Oh, yeah. You need sympathy. You're training for sympathy, empathy. Yandi a mobo. Etina yamu bebre mponi yahu ni ho. Yahu ni ho. Utumi wura labor ward. Na emba omunim omuhu enye so muntumi nkro omuhu wakata omuhu ba delivery ntinu obi abiebie no hu ya dodo bebre enti be ema edu bebre na etwa de kra afono enti enche ne ebe mawu we nyina obi amaye hwe. When was the last time you gave a gift to your doctor? So what obi the doctor has if your car or driving, go and check he has finished paying. I said they gave us waiver. It has been cancelled. And you two, you don't appreciate us. After a surgery, how many of you have done a hamper with good content? With good content. One of your meka.
Oh, as I'm trying to me experience, me quiet surgery. Me go hospital, the very big hospital what Ghana has it.
Big hospital.
No months after surgery, no.
The biggest hospital in Ghana, you call it teaching hospital.
And therefore,
and because near big hospital, because a nice hospital.
Require surgery, not knowing say after 3 months, then I was semi quiet blood test. No more shame hormonal level or no. Ne do not make fun of that on bed decrease or increase. Dr. Yan Kashi and Chairman. Yes, said me or negotiate. It's I said, me not problems, and let's say, and then optional BB, I must not be BB. May tell say, now we call US. We call US and we call hospital, monsieur. People know yes, said you, man. No one can't me say after every 3 months, I mean, blood test, someone checking me levels now, and I'm sick, Patrick and Kashi and Chairman. And I'm afraid, Doctor, no, yes, said you, man. No, catch him say, one day, cast after not Chairman. No, there's any panacasa, they may follow the panocas and not share. No, say, how? It's a Mrs. Tasiko, the same surgery with UK. Also, you be a catcher and said every 3 months, we are no bay, Miss Abbott called the automatically, but fair not that day. It's a Miss Famous Family catcher, Mrs. Tassi, me, then I'm here, Doctor No one cash was sick. Oh, there was a doctor and catch us after every 3 months, there was a weird blood test, they check you with levels, no. But one count. Me to quite now, me make how quiet doctor name man solution. I me friend and catch and say, I see me never saying this and this. So catch him say, now doctor not catch him, me percent me fair and me fair. And I mean fair.
Let me apologize on behalf of the doctor. not because he has done anything wrong. And not because I'm apologizing on behalf of the doctor, not because he has done anything wrong, neither because he has done something right. But he did the surgery for you. Is that not it? Thank God he did the surgery. You went for a review. Did you? Did you go for a review?
I did, yes. I went for a review here before I traveled, yes.
Good. And it was when you went to America, that is when you were told that you were supposed to have a 3-month blood check continuously. What did it happen?
Complications here.
Good.
I was having complications here.
Yes.
I called the doctor how many months. He didn't mind me. So I said, let me travel and go and take care of myself.
Okay. Now, it happens. It's part of the 2% of medical negligence that we're talking about. We are sorry not to apologize for his mistakes. It's part of medical negligence. However, you're right as a client or as a patient to seek for further third-party view. It's also your right. Not even in America. You could have moved from the nice hospital to Kolebu and you could have met. Come again.
I was scared.
Scared of what?
Because
no, but the fact is that is what we are discussing this thing. You shouldn't be scared. Move to a higher hospital. A higher hospital, not by design, by style. So go to Kolebu and complain. And they will do it. Maybe the doctor knows it could be one of the negligence. Something can happen. So I'm sorry, not apologizing on his behalf. I'm apologizing on your behalf as my sweetheart. Because if this could have taken your life, I won't have you to become the girl's prefect. So that is my apology. But whoever is listening to me, ask questions politely. Don't ask questions as if you are interrogating your practitioner, because some of them don't have patients like us. That is also true. A doctor must have patience. The patient to doctor ratios in our government hospitals at times puts a lot of stress. A doctor friend of mine was saying that he has stopped going to the consulting room now because of the they brought a new system where I don't know if Bismarck, your system is running on gift mix. Is that what you're running right now? That they are doing telemedicine. So you have to go on their system, go and type and put everything there right now. Now lab report comes through, and he's not feeling too comfortable as a senior consultant to be sitting there in the paper. And there are times you click on the diagnosis, it will not come, and there are patients sitting behind. And unfortunately for us, your 80 to 100 patients sitting behind your consulting room, they don't have patience for the patient who is in there. Me, I went to the patient because we're supposed to be joy in both counseling and clinical reports. So the patient went in there, myself and the doctor were discussing. Can you imagine when I came out? Those who were sitting outside. Now, counselor, they want watches. Yes, if you feel nearby you. We are counseling. You are sharing them was honey bedding come up. I grow when you so. This is what a woman told me when I came out from the consulting room. I didn't utter a word. I only smiled. Lucky enough, when she went in, her condition demanded me, and I was called back to the place. She's already spent 20-something minutes. So I asked the doc, is she still here? He says, yes, and we needed you. I said, ask her what she told me. Oh, now I grown. I mean, you can't say this to me. Disrespected me in the place. Say my question was me didn't come out. Because of what? And fun who I can't your back can't tell me. Now she has been brought to my court. We spend more than 40 minutes on her, trying to do some level of explanation, both psychological and clinical. I finish, I say, when you tell me what 42 minutes. Also, Pia, Ubi can't search your bed. Oh, there be a counselor, I'm saying, yeah, grow. The okay, it could cause somebody to think the doctor is playing inside there. So we won't hold brief. But Abner's case is rare. I'm not sorry. Thank God you came to US and another doctor did for this is medical negligence. Bismarck, You are direct with patients. I am indirect with patients unless they are referred to me. Do you have anything to say about medical negligence? I've done 1 hour, 20 minutes. I'll come back in the evening. So let's see. Yes, Bismarck, anything? Yes, I've done 1 hour, 20 minutes. I'll come back in the evening. So let's see. Why is Bismarck? You have to go and come back. I think you're having a feedback when you put on your mic. I don't know why you're having that. So go and come back. All right. So that was Bismarck. Bismarck is a nurse, a male nurse, one of my male nurses. And then somebody says here on Facebook, and we're wrapping up because it's 31. We've done 1 hour, 35 minutes. Is it God will bless you for being bold in speaking the mind of shy nurses. It's not shy nurses nurses who can be punished as a result of speaking the truth. I'm telling you, the matron will punish you and they will take your pin from you. One of the professions in the world, law and medicine, and they've added nursing and added teaching to it. Any profession that has a pin that must be renewed becomes an albatross on your neck. The slightest thing, they will revoke your license and you can't work again. It's a scary profession, like a lawyer, like a doctor, like a nurse, like a teacher. Like the counseling session, they say they form a council. So you can't speak, but somebody must speak for us. That's a painful thing. Recently in some quarters, they've transferred some people because they spoke. So some of us, we have to be quiet. But if the one who is taking care of you is not being taken care of well, it's painful. Nurses are suffering. When was the last time the government will bring cars? They will go and bring cars for us to pay gradually in our little salary. They don't do again. The government has let Kalbu is about 4,800 and something, a little over 5,000. The accommodation there is just about 1,500 total accommodation for staff. So if one person enters at age 30, she will only leave the flats when she's 60. So for the next 30 years, you're not building new flats. The whole year, you have just about 100 people go on retirement. And you engage the services of about 2,000 people or 200 people, 500 people, sorry. And they all need flats to live in. Where would they live? Where would they live? And nurses are supposed to dress from their house in their uniform to work. They join Trotro, they get to work, and their dresses are soiled. So now nurses don't even dress as nurses from home again. They come to the hospital area to come and dress. And that too is warranting punishment for them. Wear your uniform from home. But the white uniform, you can't sit in Trotro, you can't sit in taxi, and you can't use your salary for Uber. This man can be why now. I'm sure I'm a candy and can hear you.
Oh, I can't. What do you mean?
Pass is here, baby.
Oh, okay. I draw sugar and baby, I'm sorry. Like, Nikki, I would say. But one time I person address it like before some made the middle into that negligence. Ajua, maybe if you
hit the like button. Oh, let's go to 50. Hit the like button. Oh, Musukura Mubiabo. This my Kasayo.
in medicine or in nursing, always there's updates or evolving of things.
That's true.
If you ask time now, doctor studying how to do the surgery. Nay, yet 3 months post blood test. So in the center cancer in the first instance, where your surgery, just be grateful for that aspect. If you are post surgery blood test, and if you are mixing, if you are in the school of thought, nay, yet post blood test. It will be an intention. Minimum conversation and have a be a true intention why that one and I really feel. And I say no one in American every day you research, you updating your man. They call by Bill and maybe a young Ghana. I improve it. Me bag Ghana and we say, oh, send your man in 2020 or 2019. Every day adapt it. So every day you research. Like recently, protocol for managing DK have changed in UK. It's so you see old method in the manager, old operation no hotel. But you say you have a new method of managing DK.
What is DK? Don't come and confuse people here. What is DK?
Diabetes ketoacidosis.
What is that?
are diabetic, obi are diabetic. Now, what I'm going to do, the body will resolve the fat level or body. So when the body breaks down the fat level in your body, the body generates acid before ketones. When these ketones become too much in your body, we get a condition called diabetes ketoacidosis. It's one of the common complications of diabetes mellitus, especially type 1.
That is my son. Yeah. What being rough?
Yeah, protocols are managing all this, and each and every day it is evolving based on what researches that we are doing. We are sorry, but you have benefit doubt in the mother doctor. Now, if you are now when you latest research say you post blood test after the surgery, and to delve into negligence, cancer may blame patients relative me patient. Me blame your staff now. If you mother no I don't know me who was a day. They want to appear angels in the face of the patient. Story ana koku narrating in now. What must be na feed all the information to the patient or more narrative to the public.
Oh yes, yes. I was in a place where a colleague told a patient to go to court because he will win because it was negligence. Court, yeah. I'm telling you, I was.
So that's why I'm saying that I will not blame them.
Yeah,
I will not blame them. On my one instance, I will be say a junior doctor. Will be about hospital. You will find born and also a junior doctor and also a student doctor. Yeah, staff in the baby one man. I just say, my operation into we a junior doctor.
Thank you very much.
Because that relative no theater room. How was he able to know say junior doctor? So always I'm in blame on my match. It's more Egma. That vague negligence nurses, doctors, I am a head because I am more information. So now we're narrating what we go through to bring patient to life. Now now we're smiling. My saving patient because we in Barbados. Whenever a patient is having this condition, no HB, low level of blood hemoglobin. It initially comes 60 hemoglobin level 60, which is a BEMA, is really, really low. So, yeah, man, 2 pints or 3 pints of blood, and a patient blood volume back to normal. So, anytime I put those things, hey, you want fix the patient.
Okay, so you see, for example, you said hemoglobin level of 60, but in Ghana, we are doing 2 digits 10, 11, 14.
Yeah, maybe in a measure, who you should gram the deciliter now, and I'll be issued that 10 to 14.
So, but
100 to 120.
Yeah, so in Ghana, we don't do the 100 to 120.
Yeah.
Did you
gram per deciliter.
Thank you.
10 to 14.
Thank you. So you see the disparities in medical. It's the same thing, but like you just said, going to Barbados. Like you come to America, they don't do kg, they do pounds. Yes. So weight, they do pounds. And in Ghana, we do kg.
Yeah.
You get it? You go ahead, we're listening.
All right. So when we are relative, because a patient start beheader, IABB,
and you save the patient and you are happy, and it's a record.
So we are head and say, well, IABB in a sense or damage or so they'll refer to a patient. It is that case we should send or see a delve into what actually happened.
Yeah.
In the near fact, say patient negligence. So Baba panel autopsy. In fact, yes, you class a patient.
Medas. Most of media example. Yes.
And yet, yes, patient.
Yes. And your injection on the phone.
Your goodness is funny doctors.
Any hospital in any must.
So that's my point. Abna, madam, sorry.
Abna,
my dear.
Abna, doctor. Abna, they say, oh yeah, choice. But this is a lesson to the rest of us. like my son just spoke, we can't defend negligence in medical practice. However, we want to find a way to curb or reduce the level of negligence. And I've learned something in my life. All my colleagues, I tell them, don't wake up unhappy. Wake up happy. Because, Charlie, it's painful. Imagine, what is the time now in where I am? The body should go to, those of you who are watching my prayer or whatever, in Ghana, as at 5:23, I was up. So me die. Me boa. Yes. Because I'm supposed to give a lecture in Ghana. And I have promised, yes, I will do it. This is a huge sacrifice. If you're chinebo to say abna ako chen car. Why are you not happy with some of you too? We go through the miles to give you what we're supposed to give you, but your appreciation is poor. Some of you don't know how to talk. And there are times that you meet some doctors and nurses at the wrong side of their thinking. It is normal. Yes. We do, even like Bismarck is saying, some of us, our colleagues do that to us. I remember I was here and a patient went to the polyclinic that I had a referral to go and do whilst I'm here. And I said, when you get there, give the phone to her and tell her that I want to talk to her. Can you imagine that this junior cockroach nurse told my patient, Ombraha, and say, I won't talk to the person. And I say, what is her name? The lady is not getting her name. It means only name tag. Okay. So and I sent her to another senior person and reported her to the senior person. And one can't say, don't wait, say a me answer. I don't know what Jimmy sir. And unfortunately, the patient works with the radio station. So she's like Bismarck, she's speaking the information. I have to apologize and said a lot of things because when she goes to sit on radio, it will be a bombshell for us. Our own colleagues at times, we know they are frustrated. We know their system is not good for them. We know. But our happiness is when the patient is happy. Imagine you are taking care of the president of the Republic of Ghana. Oh my God. Happiness. But I will not give Nanado the chance to give his life to a system that is not fully equipped to take care of the sickness at his level. Because Obiaya will level. If you can afford, please leave the country and go to where? Or would you be worried? Where did my uncle E.T. Mensah died? South Africa. E.T. Mensah died in South Africa for medical checkup. When he was alive, he had an accident. They were playing ball and he broke his thigh. He gave credit to the late President J.J. Rawlings. I interviewed him. Not as an uncle, but as Father's Day. He said the reason why he would be always on grade, he broke at Legon. They brought an helicopter to pick him. Did everything for him to be able to walk. They flew him to South Africa because we didn't have the logistics. You are here saying, say, how many years now? He's lived and kept going to South Africa and his wife. Look at our footballers. Kwaku said somebody was supposed to be operated on the left knee, and before the footballer realized his right knee had been medical negligence. It will happen. But I'm telling you, I didn't answer unfortunately. When we go to the theater, there's a screen there with your X-ray results. We look at it and be sure whether left or right. It can happen. Now, listen, when we are doing surgery, the last time somebody brought a case that they left a gauze after the suture and they left a scissors. You know why it was left? The team, because this is what happens. And Bismarck will testify. Before surgery, the number of forceps that is released, the scissors, the blade, whatever instrument is given for a particular surgery on Abna, it is counted, not because somebody will steal, but it is counted so that after the surgery, you bring it back for sterilization. It's counted. When we take in gauze, we do a package of sterilized gauze for surgery. If it's 20 pieces and the doctor finish, the ones that he used is counted. The leftover is counted. Do you know why all these things are done in medical surgery? So that we don't leave any in you. So if after all these checks and balances, we end up finding the doctor sutured whilst the gauze was left in you, yes, it's under the medical 2% negligence that is done in the whole world. It's not deliberate, because when your patient, when you leave a fair, unacceptable material in the patient wound and suture, it will be abscess. There will be an infection. Do you know how it pains to go and open a wound and resuture? We too, medical practitioners, we also need to be treated well. China, I'll forever be grateful in China. Charlie, you can see that after the break time, you go to where we eat. The environment is so nice. Everything you want to take, oh my God, food is available. There are times even snacks that we are supposed to be giving during consultation. Yeah, the cat. This dialysis issue that they are going to deal with people who increase the price. You know why the price was increased? Because the reagents, Yenyes can't talk. Reagents, you know. People go to do dialysis at other places, Canada, so hospital, and they pay close to 900,000. And they come to Kolebu, 380, 420, the same reagent. I'm saying that to fight medical negligence is a collective effort of government, individuals, practitioners, and God. May God help us. If you are listening to me or watching me and you don't go to the hospital, I'm pleading with you. Please go. Do the in check, middle check, and out check. What do I call middle check? Check in January when you are entering 2024. What am I entering 2024 with? 6 months, check. What have I acquired that must be dealt with before I finish? When you end December, check. What did I end the year with? Not just your money in the bank. Check your health status. Because it is possible to live longer if you know your conditions. We don't pay for dialysis in Canada. Yes, because your medical insurance is paying. We have to pay because we don't have medical insurance in Ghana. Even health practitioners, we pay for our own medical bills. Yes, we pay for it. Those of us taking care of the patient, we pay for it. We don't have medical insurance here. Unfortunately, the health insurance and things that we have in Ghana, they are limited to what they can do. Any major surgery, you pay for it. And see your salary. We pray to God we don't get sick. I took my son one time to the hospital. That's about a month ago. And when I took my son in there, before we left the hospital, we spent over 3,000 Ghana cedis. Yes. Yes.
Yeah, I'm for it's kind of also.
You'll be out. A lab test. 3,000 American and former doctor be out. Diagnostics.
Aye.
Diagnostics. Koyewe. Because medicine is expensive now. Healthcare is expensive. Yes. My friend came to Ghana and we had glasses. We were going to spend like 1,000 Ghana cedis. for the type of glass of thing. She came back to America and she left her glasses in Ghana. So I said, oh, and she went to report. They said, your glasses is due for replacement. So come and choose a new frame. The insurance has already paid. Okay. I mean, it's painful, eh? It's painful. You have a nurse who lives at Kuntunse and will have to be in the workplace 6 a.m. She's in traffic. She's in traffic from Kuntunse to maybe Rage or Kolebu Teaching Hospital. Patients are not appreciative. The patient mouth 20 cedis up. When Mama Gigi Sikao, 20 Ghana cedis. 20 Ghana cedis. Is it more? I'm not 20 Ghana. And people come to hospital and me. I'm a living testimony of giving money for patients to go buy drugs. I'm telling you. Me. I'm telling you. I pay for people's lab. I'm not bragging. As I'm sitting here right now, I'm supposed to send 1,280 Ghana cedis before 5 p.m. to take care of a patient. We know Casa is here, and I don't have mediums of sending money from where I am.
Now, my little sister in nurse, and I pay the occasion more did you what do my patients?
Can you imagine?
No, but that's what can say, Mammy, to me, and say, hey, I say, more boy, I was so boy, I'm boy.
Me say, if you are healthy by the grace of God, thank God. And if you know what sickness you are going through, please protect yourself.
Hey.
If you have diabetes, please, it's not curable. Take your drugs and manage your pancreas, manage your kidney. If you are supposed to exercise. As I'm talking to you, I'm supposed to sleep. Look at me. I don't know what is called
dressed up.
Yes. Only put on diet.
And what dress is it?
Oh.
And coming back, we start saying coordinate glasses in the bed on me.
What do you want?
What dress is it? I have lived in Ghana. Right now I'm in Ghana, but I'm a Canadian.
Yeah, we'll tell you.
And now, maybe I can say me and then I'm near Madumua and Casabin can keep a king. And then I'm king, Grashana can become a crown from baby SS.
Wow.
Oh, yeah.
Wow.
Because I remember sending a call. The call Canada somewhere in 99. That was when I was diagnosed. I have a problem with my sight. And the funny thing is, growing up, because I mean, who board me so intro notes. Intro notes. My exercise book about makes me the accord the whole year. Into the how I'm passing is by the grace of God. And I'm getting there, Musa. Why? Because I cannot see the board and I'm tall. You can't put me in the front. But I said, or checking these kind of things, but I remember when my mother put in the sponsorships I ever call and you medicals. That was when I was diagnosed. But even that one, they couldn't tell the problem. What was the problem? The problem with my eyes. I went to me and check. They don't want to say, your mom is some eye drops, eye ointment, beanie glasses, and that was it. And now they call Canada somewhere in 99. So I think 2001, my glasses is overdue, so I have to go do another test. And now the correct test. That was when I was diagnosed with glaucoma. And this glaucoma, the doctor was shocked. It was advanced to the extent say they are expecting this kind of advanced sickness on a 95-year-old.
My God.
And I was 21.
Oof.
Yeah, because and some of it will say, if you are a genetic, you inherit it.
Yeah.
and a soon old age.
Yeah.
So mine was in like genetic, right? From fee into my inherited from fee at a young age. Now my luck can come in here because that's what happens to Stephen Wonder and Ray Charles from birth. You know, I've gone through almost 5 surgeries in Canada, and each surgery piano about $35,000. $35,000, but due to a system that works, a country that takes care of its people. Watch us. I never also my better was Canada. We don't pay for dialysis, but also insurance. This has nothing to do with insurance. So, and your taxpayers' money, yet tini power from the amount of insurance be free.
And insurance now. Insurance now.
Taxes be free because the taxes goes through investment and it comes back to the people. And these are some of the benefits we get from the taxes that we pay. And this way, everyone you see a 15% to the jail tax, whether you like it or not. These are some of the benefits you benefit from.
That's true.
Oh, I never pay a cent. Never pay a cent. Even cry with this kind of surgery, you know, the country they decided to say no. The amount of surgery my eyes have been through, and I shouldn't work in. I force myself to work. But maybe someone who said, "Me Ghana, where would I be?"
Oh, naka when you're blind, mo, but naka say brain, we obituary.
Possible. Possible because at that age,
sister, it's possible. Now when you're glaucoma 21 years, near see a 91-year-old, you should be that the work of which camp go that. Sister.
You know, and I remember saying many once, even though say I wasn't taking serious in Ghana. Also, for being once, I think it was a pie life back in the days.
No,
he says, no, you have eyes problem. Take care of it.
I'm one fee. Yeah, no, I
just want to okay. At that time, no man.
Or they are champ obey so.
Oh, compared to me come me woo and Palau 50 day one. You're checking us something. Hey, I send me now.
No, Ghana, I hear the same thing. You batch your Ghana, I hear the same thing. Oh, yeah, but me batch your. Me batch your. Need the mama kasa. The mama man can pray. Oh, yeah. We check the ear, we check the nose, we check the eyes. We bring all, we take you go through all these things. Just that there are times said.
Give me 2 minutes. Just give me 2 minutes. Then you understand where I'm going. No, they want. Hold on.
Muyi aye. Oh, muyi aye na mujade muyi. Eti na moncha ya di.
Hold on. Yes, they want at the hospital in Ghana here. That's how they almost finding out who's it do a jaundice, it do a hearing problem, it do a seeing problem, whatever. They do check. But after they check you out from the hospital now, we PF hospital now, we walk away, you know, after 3-4 months, you know, nobody give a hoot. Can't just say the truth.
No, the hood now can akulani ya wamba.
You see, that is the problem. No, that is the problem.
No, me question won't take question I say. My first diagnosis amount, mommy team. I have done day one. I have done day one diagnosis for you. You have gone home with the child. I tell you what to do with the child. If you think the child is who a weighing card? Who a weighing card?
I still have a weighing card.
And to show you a weighing card in more. Who share from day one. Your child will never say bra. They are mumma. Yet to me, friend, you need to tell for better friend. You man, no mammy.
What's the wine back? There no make difference, you know. Wine back. Check. Celebrate to be called Canada. The moment you push that baby out,
automatically that child belongs to the country.
Because the country doesn't have human beings, you have numbers. So what you Canada won't any power. We are number.
No, when it has a it's a say as well. But BBC work and Indian High Commission will come and pick me up just like that.
Say we are number. It sounds say we are number.
I am the country's citizen.
No. Mami chair was here.
No.
The mami chair me number na say e bia wan tie ase. America for nyina was social. Canada for nyina was social. And the human beings you reduce them to numbers. And yet me who want them. You have nipa ba ko take and one te report no. Only ba ko send birthday 4 times. They were buying kratem until in retirement. When this system now so still no 53. Last year no 52. What's that? And young kasa ye numbers. Ye human beings. Momo ye numbers. Enti na edu manage mo. And about me abasa ye numbers. Na yam peda. So yes so ye bebe kuro no. Kasa mama numbers.
I can't even argue with you. No, seriously.
This is why I'm dressed, even though I'm not taking it now.
The point that I'm trying to make is saying, even after the age of 3, you are able to hold my baby or letter. Time my son said was checking in me, and then I saw hearing, and then speech. Because speech type to make sure say or according to the age. Yeah, the according to the age. To say I'm a better now here, and I pay I'm an achievement and colonial friend say me last born at school the letter back the social worker and he for now want to see me. Why? Because I'm only a little bit delayed. And class 5 now one. Or more expect to say class 5, no being in a match, but no match to say class 4 because Canada in repeating color, you go with your maturity. And you know, or no, maturity, no, and any class 5 for them, some person you know, different special class altogether, don't call anyone. Me could drop the chance and I'm just saying, or learning disability. Number 2 university.
Oh, but not saying now what Ghana no who will learn disability now.
No, who told me that? You see me tina the report card barrier for me.
And said now you don't know. I say who board no so. And you know, and your fault now what too much and so. And yet me find caught name. And you who say we're learning disability.
So why nobody cares?
It's not that nobody cares. The thing is not nobody cares. So you can be diagnosed.
Teachers didn't even show consent.
No, they were what you call consent. Teacher then who say, oh, what? The first concern is that no, the first concern is that you are too tall, so sit at the back. You don't see the blackboard. You don't see the blackboard.
Yeah, in Germany, me old school. Almost seen it in the mass, good with mass. They have to take her. Check like say, although she's okay. One person who say identity on your good in mass. Check it, or you're very slow when it comes to calculation. What you say?
Yeah. But Ghana Hano, yes, we check you. The Yan say anyone trama me biano so. Oh, turn blue. No, it's my man, sister.
You understand?
That's what I'm
Yeah.
Canada when I think I was diagnosed in Centennial College, and the same month they diagnosed me, they changed all my books to e-books. Okay, I did all the books. No much honestly, they have e-books or they have audio books. Okay, because it's a my ear used to not reading at all, and to forget about reading. Okay, so once they changed all my books to e-books, within one semester, I became a straight A student.
Wow.
Hey, Namu you.
rotate me.
You rotate me.
Yeah. Camera, you see this face there, Johnny. If you see this face anywhere, right?
Mami face ni. Mami face ni. Hey. Now what that sorry that na who face? What that sorry ni? Oh ma, who are fool?
I'm still even on my breakfast and I decided to join your life.
Hey, your breakfast now, di. Nyamia yebio. Eti misi obi nto ne busu ajapade no fa kwa abrochi Ghana fo ntem ase. To abusu ajapade no kwa abrochire.
Not knowing, maybe Germany have not knowing. Maybe I know and Chebia, Mr. Tejumano, Nantika, I said many such shame.
Hey, Bonsam.
I don't know what is wrong with me.
Demonic attack.
Into me call me house doctor, and all yeah, me work or still bear me lab test. Na shake. Oh yeah, me lab test. No, who say, me blood, no, a swati. I come from crowd.
We are anemic.
And see what do they have to do? And some family call the main way hospital. No, fati won't question me. No, say why the antenna me blood swati sa. Until they took me almost the machine for the thing. So almost the tube, almost correct me crowd. And almost the tube, no share me and almost share not knowing you were fibroid.
Until the tumor, the myoma was sucking the blood.
Yeah, multiple, and yet 1, and yet 2, and yet 3.
There's 7.
Multiple. I know, like 5, and they are sure say inside, if they were inside. So what do they have to do? Yeah, beside me say I should go and think about it. They say I was 3, me was mad 3. So I should think about it. They will take out my womb because.
Hey, sister, a woman for you. A woman for you. When you say you do and you do.
But by now, 2 months ago, they took me on see.
Oh, you do about it, mention. You do about it. You do about it. Cotton, yet, but you do about it. Much you won't buy you do about it. This is a cotton yet. Why? Bema tobu ye kan die ya wa yi wa no ye din na mba ne nkasa ye kan die ya wa be kasa ade na atisa ade nchi
but what the counselor me catch up say me control na me okay omo no aha no wo bi in class 3 I think it's okay omo calculate years no the last one when you 12 years
okay
me last one
okay
okay to me, I fibroid no without cutting me.
Yes.
Chino.
Ghana cry.
But person coincide no will be beer one clear.
Yes.
No one to me be beer and a second so possible say. Years back, years to come, the best be
and the other back
is like that.
Now, would you have started sex?
Me woman first born now maybe 23.
And you started sex at 23.
No, and me started sex. I was in secondary school, so make I say around 19. No, I didn't start sex early. No.
So 14, 15. Were you having sex? Were you having sex regular?
No.
So you are doing regular. So you are doing remedials with your virginity. Okay, that's why you had fibroid.
Yes. And see, make a chair doctor and say I want them to take the womb out.
Wow. Were you married?
Infections.
No, were you married by then?
Yeah, I'm married.
So you consulted your husband?
My husband, yeah. We sat down, we thought about it. I was okay. For me to be well, and I went through that process. Charming.
Yes.
Like cesarean, charming.
Yeah. Say woman, they ain't doing. You see,
yeah.
bikini cat
yeah, and ye with woman and and catch me say after operation also possibility say infection bet me okay. Into infection also they know how to treat the infection. Into honestly, me within 3 days they saw say infection okay. So I stayed in a hospital for 2 weeks because they have to make sure say everything, the infection, everything is clear.
Ghana so your mount go fi you bet treat areas na wako yanko.
Counselor. Ghana counselor.
After the surgery, right? How was your sex life?
Or no, I don't pay sex dada. Or no, I don't pay sex dada. Or no, I don't pay sex dada.
Like counselor, no, I can stay 2 years without sex.
It's only a fibroid. No, dino.
Yeah, that is
on this abnamosa. Dino.
And but after operation, no, like sex and yet normal sex, no, and yet normal.
No, when you say it's not normal, no, hold on. When they take your
and then nice.
No, but
let feeling.
No, but no. Hold on, sister. Oh, hold on, sister. Wait, I'm not saying what I say is not true. To us, sister. Yeah, you womba. And say what think cool. Not just a woman. No. When your womb is taken, it shouldn't affect your thinker. No, it shouldn't affect it. It's far from it. The womb is far from a thinker. Yeah, you clater, and I think can be and also be into me. Because maybe I think can shame any womb, that you say, it could be psychological. Say, Wunama, what Bia will say, yeah, you won't be into you lost consciousness. Also, there are times that, unfortunately for you, your desire for sex, you have low libido. We have phobia 3 months, 4 months. Yeah, DAB. A train fire, Musa, a funa, a shading tea. Mimi, phone tiama, a train farmer, Musa, and you said me who any ho. Made him post me, yeah, dear. Me found cover being what I say. But yeah, dear sir, but me say me, yeah, dear, until I'm a tiff out you. And we are seeing for that counselor, little, a genius, same my ass. But no credit, sir. Oh, me say me 20 years near 2 minutes. Me name say 2 minutes. I mean, 5 time in talk, but me sure.
I saw him yesterday.
Kaswa King, why are there? 80 no credit, sir. When your womb is taken, you don't lose desire for sex unless your desire is not there before the sex. So please. Let us learn, seek for counsel. So right after, were you taken through counseling before the surgery?
Yes, they will take you through counseling and printing, like they will, even after counseling, they will tell me amount like appointment for just the counseling. After that, printing everything out. They printed everything with the womb, how it's going to be done, everything. You can go through.
You know, the entire Ghana and Yajuma, you refer for some about counseling. Yes, your moon tia, say nipa de nibe kasanso go tia head. Ayo here, and Tim say, why would tear me? Time we shall jump at the end of Quabridge.
Hey, advantage in this
Sikani wa unsem na de bua busua sakola ni school fees kra fakọ onni no kwa brochire a me auntie enya first degree at age 42 Kennedy Japan Echo University 832 where Jai Obesan Kobu. What I say? Enti no krene woman is say Abranti be a wutie opportunity be banner nya krono by it's a clear opportunity. Don't waste it. Have a dual citizenship. Shemaya Kasei.
Yeah.
At Obrebia Mobre or Ghana, Mumbebi and you da.
Amen. That's it.
Because you give them the start.
Yeah.
We didn't hear these things. So we didn't give our children start. Yes. I'm telling you. Yeah. And you see, you are still alive talking because you had a better diagnostics. Thank to God. See, I machine idea glaucoma. Edibia by ho. And see, Ghana, with my diagnosis now. They are more canning ya or Ghana. But Ohienti, meaning can say we are go to your weighing card. From the page to the last page, you are told the signs you see in your chart. If not, report to your medical practitioner when you go to weighing. But in California, oh here, why your sister here on board is sweet. The bear more and say, we a tianka, you know, baby, but oh, yeah, tinti, what who he? Tenyamia, and your mammy never chin call Canada. Naka won you beer. Naka would have yeah. Enti, yeah, and you so being a person quite you. And then you say, you're person gonna be ye. But gonna be ye not check, and I may and woman send me bear gonna ye. You see, baby, who ye? I mean, to Ghana.
Because counselor, I mean, I know one song we have operation in you know. Who say it might infection, but guess what? Almost the way no share my seat, they are not sure. But almost some person sure. Into almost the week share machine move. Some machine no. If I'm in Ghana, some machine means yeah. What will happen?
By your machine be. Your machine be. You will be. We have some. Mount to me, yeah. Yeah, you can pay.
You can pay.
Yes.
Machine no come me.
I
was like, God.
Who will be there?
And me will be there. And I entered that machine for like, oh my God, because that's true. Me will be there. Me will be there.
And you know you did say now branch be basoba wana kwa brochia mani nkono njawa wale
counselor sanya that machine that detective baby infection no what you see
wow look
I want to detect where the infection was.
Ghana has continued to determine Ghana has infection baby or continue to move you do we na ba ho
I by our standard. What?
Sister one can be can. And the most of what you abroche, we to know higher date in Ghana. I beg you some munja. Yabeko.
No matter what, approach. Because everything works here. Everything.
Nanado 8. Mama suit you. Ade pena ye tie wo ni apon. Mo ye apon na mo ba mo grofo yi. Go ahead.
How did you get it?
O see, I will now ni way in Canada. I demand.
How do you get it?
Oh, baby, I want you anyway. Medo. Na medo abere what the other way card go ahead. Abrewa. Mami tie me. Ade pena. Ya wo fia na e wo hospital. Ubakai. Ya catch them. Ya wo hospital. Ubakai hospital na e wo no. weighing card here nyama. Best at the end nyama. Weighing card here the mama me. Aha. And they met my oh and they met my amaya koji abrel. Yes, and Crawford and Becco share. As they say, I wedding 29. Crawford and Becco share. I made you $29,000. Bomber Pama. Jose. Me and who possess who of us? Oh, that's just by the way. But for weighing card, for birth certificate, we can get it for you, but you have to pay for it.
Okay.
No, we'll get it for you. You have to pay for it. Yeah. And I can help you get it. Okay. If you can remember where you were born and give me your detail and you pay, I'll get it for you and it will be printed out for you. Why?
No, need birth certificate, no your passport or two coin.
I don't put the where be sa Ira or your passport we and so far. But you're not telling what about to say be a good to call him. My being sister Ira, I am I see quick granny certificate in so far coin. That's why we're empty. Why? Well, it's been awesome. We have a lecture at 5:30, and this morning we're talking about medical negligence. So you tell you say a throw down. The idea in Sumana a peer. I didn't summon a year. But the idea in Sumana year and Suba candidate. Then I'm sure my CBP and I walk on.
And I walk on.
Nyami shira mami mo nyami shira won. My dear, I won't bread and that form. Busumi kono. Uwi enso ese obe kaida awo no. Me say they be a me can microphone to say, but onipa bia me tene so I'm sorry. Men tran so mani wuda e me yire ma wari enum kura me yire panyi me tene so I'm sorry. The level of confidence my wife has in me, I will never disappoint her. I won't. I don't know how to please her, but I know I will never disappoint her.
I really respect that woman a lot, to be honest.
You know why? I remember when my wife had
kind of trouble you bring to her.
Oh, unfortunately.
The kind of trouble you bring to her sometimes.
No. One of the things that has never happened to my wife is that my wife has never gotten any trouble from me. As we are doing the live, it's 3 hours now. She's watching. Why is she watching? It's not by force, but she's there. So I don't give trouble to her. She knows that I'm a mochiri man. So when I come home, I can dream and start shouting. Well, she knows.
That's one of the problems I'm talking about.
No, but if you are married to a driver's,
that's what I'm talking.
No, how does it become a problem? You are married to a driver's mate, and in his dream, and you are angry. Who are if it any? Who are if it any? I didn't also agrees. So my wife is too happy. She knows the work I do, and she knows that she's protected. But I'm saying her confidence in me. I was sharing with a friend that the level of confidence my wife has in me, at times, I wonder. So my wife, when she had the first child, it was CS. And the second child must be CS. Unfortunately, her first child, and you see, this was at times, those of you who don't give me money, I see you are wicked. Because listen to me, when my wife was pregnant, Really? You go explain tire. Yeah. Me come out your children. So this one is $850.
Yeah.
Yeah, this is $850.
That's my point. Yeah, me buy my baby me the and it's 1,002.
Okay, So time I'm turning, but a do or see a time I'm turning. Sister, men fan board dream why now one number on who I feel I bet you see can't dream one look up bomb. Do you want to Kafra, sister. Kafra. Oba.
That's my prescription sunglasses.
Photochronic. Never answer na ira sister. Wouldn't say when you yet. Now then I call you that way. Sister Barney send I call you that. Also diable. Oh diable. If you are before how Banson I call you, I mean vampire son officer or how you I don't call you that way. What is a brand here? Of course, so good. You person and express either. Who to create. When you are there, me Charles, so my main country in medical negligence. And I'm telling you about my wife. Hear me. When my wife was in labor, when I said the eyes of the finger looks for the clates. Me that's a sister. So medical negligence. How are they? So medical negligence. When my wife was in labor, I was in the studio. This story, and my wife cannot drive because not her first time on wood, on Nimuda, on Unkwa, she left the apartment and was carrying her bag and walking as late as 12 midnight. Now me hear program be your friend real talk. I will Joy FM. Once a day, because the media phone on my yamina, omumboa me, yami chiabibika. Any Ghana for anyone more on near Namuti, I was lecturing. In the way to ya. May you have him. Moma can munjin fa. Nyankopon do bonia. Go and sing no more. Go and sing no more. Me kind of cry and more can Bobby. So I was on TV having a show. My wife was in labor. And she managed herself, walked close to 25 minutes in labor because she had a car and she can't drive. Car she had her own twin driving. And this woman was watching me on TV. And she knows when I'm on TV, my phone doesn't work. That day I didn't go with my PA. I was on team. I was watching me. And I'm here, show you. I was taking pictures and smiling. Then I went for my phone. I saw that my wife did my wife and friend me one. For this woman, the way God will bless my wife, she will not die now.
Amen.
Look,
Amen.
I will name a street after my wife. No matter how many women are married, I'll name a street after her. She doesn't know what I'm talking about. Listen. You don't know. I was sitting at the studio talking, working for multimedia, and my wife was in labor. She walked to the roadside and met someone. Hey, let me just don't call him. And she smiled, said she's going to the hospital. And the person said, my friend, I'm up on 1 o'clock. Carried my wife to call him. I closed the show at 1:30. Then the friend called me and said, why are you calling me plenty? Say your wife is even insulted me. Why do you leave your pregnant woman at home? I say, my wife knows she's pregnant, but she gave me a dress to go on TV to go and teach. Then I left the studio, went to meet my wife. That first thing, she went through CS. My wife was never happy because of CS. And she told me that she knows very well that if truly I was around, they could have not done CS. She would give birth. Hey, I pretended I didn't know. But when I came, my wife was happy. Listen to the funny thing. The doctor who was on duty didn't know that was my wife. But she has closed. She's supposed to go home. She said the reason why she didn't go home was because the whole day She has not seen a patient who smells nice.
Oh.
When my wife came and she lifted her leg to check the position of the child, you see the smell that came from the dress and my wife's vagina made her feel so at peace. No babe na onyima. Ne hu ye hu am say. Till today, she's asking my wife, then now got it, yes, someone been no got it yet. Till today. It was later that she was told that she's Mrs. Lutod, one of our staff's wife. Instead of her to go home,
I'm paying for my insult.
this is small. Yeah, I went to see my wife. She went through CS. She's never happy. Now, what is the story? When she had a second child, she was later to come to the hospital on Thursday because after your first CS, you need to go to second. You know how it is. Can you imagine my wife looked at me and told me that when we came back from church, I asked her, what do you want? Because you're supposed to go in. She says, I don't want CS again. I want to deliver without going through CS. And the doctor and everybody is prepared. Now they know counselor they are already waiting for her anytime. She's supposed to come on Thursday, so she will deliver. And I said, is that what you want? Close your eyes. And I prayed with her and said, God, this is what my wife wants. If you have called me and I pray for other people, answer her. Can you imagine that we are there? And then my wife started dilating. Why is not her time? I live very far from the hospital. If you don't take care, she's at risk. This woman said she would just follow what I'll say. Long story short, she gave the confidence of a medical negligence to a husband like me, and I delivered a child in the bathroom. A CS woman. This is the level of trust that girl. Yeah. When I called my doctor and told my doctor my wife has lived, I said, stop fooling. And my wife was laughing. It was like, what is wrong with you? The woman slated for CS has so much confidence in me that I received a baby at home. I won't tell you how I did it. Now, one of the things that was able to give me opportunity to deliver the child was sex. But if I'm looking at medical negligence, that she had confidence that a CS patient would believe that this man can. I took when the baby came out and cried. When the baby was coming, my wife was brushing the teeth in the bathroom, and the baby cried, and so my baby was born at home after CS.
Wow.
See the third child. The child too, they said, this thing I did, I shouldn't do again. Somebody's daughter. And she will laugh at them because she believes in me. The third one, the same thing. We received the baby at the entrance of the hospital. She has broken medical record where a CS patient has delivered 2 children through SVD.
Wow.
When I talk about my wife, people don't understand how I talk about my senior wife. She has a crazy belief for me. And I'll never disappoint her. Even if I marry 400 women.
You won't disappoint her.
No, if you want me to disappoint her, I won't do.
No, we don't want you to disappoint her.
But you see, I brought this story for you to see the level of medical negligence and the service that we're doing. I was rendering service to those online, and they were just insulting me. They didn't understand what I was talking about. Today, on this same page, somebody comes and says, 9 years ago, I said something she didn't take. Today, she's regretting. Why won't I sleep? Wake up and come and sit here 3 hours and die. Look at the way I'm dressed. Yemu bi nyame frɛ and say be adwuma we. Enti kakra wo nsema boaye ne gya ye ya no why. I pray to God that all of us will have a story to tell that will turn the life of somebody. Your eyesight is back. Your fibroid is gone. And today, you are a happy person. May God continue to protect us and guide us.
Amen.
May whatever will bring us disgrace be taken away from us.
Amen.
He told the disciples, every day you pray, say, deliver us from evil. Evil will come, but may God deliver you.
Amen.
May that which will kill you be exposed. The lady said, Apai Life told her that she has an eye problem. There are things that medical science cannot find, but God can find.
Yeah.
May every hidden sickness in your life be found spiritually by right people in the name of Jesus.
Amen.
As you go through your second 12 o'clock, in some few minutes, may God bless you in the second 12 o'clock.
Amen.
You will not be a burden to society, but you'll be a blessing. Thank you for joining me. I'm happy you came to spend time with me.
And bless you too.
Thank you.
Bless you too, Counselor Lucho.
Thank you. Thank you.
We love you so much.
Thank you for loving me. And thank you for all the gifts. Abner, thank you for your support. I always be grateful to you. You give me encouragement to come. When I come, no, whatever you're doing, you come and show your face. Dear Penna, thank you for the gifts. Thank you for the gifts. I hope that one day somebody will look at me and say, Abranti, umbre kura wasasi. So now some say me chill. If you be now dinda so. Efe. But you got try the anam de buye. One counselor. Me jina baby got 12 you me pan say why. And yes, I'm a counselor. On find a kwasi asam so. Time okay we na me jina ne nche me say ohima me de aba.
No.
Unti obi ase a me mboni bia. Ati ye ma refi. Beto de bia enka ye nso ye. Enye obi a na bete ase. Obi na beka na ase mama ye nyina ye hu se emwa obedi. The sun can be. For you to become rich, you need to have a level of wickedness. There are times that instead of you spending the money on those who are in need, invest the money and use the investment to take care of those who are in need. Ubi anko abrichi anka wo. Nyame mbwa. Wa abrichi onbwa. Men sign ba ene won sapan. Wa person kwa abrichi krata sen bi nyame bie kwan ma.
Amen.
Brebi a wa femu a wa bre wasasi mema wo ma embresa.
Amen.
Osima medi nyame achi ache. Me hu otini bi a na sefo esresra de esanso otini no ebie kwan pa ema na chima enti omo nsra de.
Amen.
Mema wo ma ensra de.
Amen.
Oma kwan bi enbie ma.
Amen.
Mema wa money ense wo shebre.
Amen.
Obi a oti awade boni bi Nyankopon yi wo enfi awade boni.
Amen.
Bible say na Abigail oni Jimmy for naba na wale. Nyame ma naba ewuye. Ema David ebe ware Abigail manu dane nyamfo. Yemu bebere no. Yatimbe me Jimmy for ho amede. Ye shebra ye tantan. Nyame mpe kon be yi wo afi akwan so.
Amen.
Yatimba abesefo eso ama enne ye edi akawim nyame yi samba ni fi akwan so.
Amen.
Obi oti ye shebere so nyame ngu n'anim ase.
Amen.
on fire siri and share a phone.
Amen.
Yakura enya ma emburu so.
Amen.
On my ye any adoye endi ye chi.
Amen.
My efrati asefua yansu ya kahubi.
Amen.
So hini amesomo na ongu beni masida unshiramo. Obi odi akoma pata me chinyame nhira.
Amen.
Obi afi no benya akoma pa eta me chinyame nhira no.
Amen.
Obi otame me sira nyame adoma na se onya adwensakra.
Amen.
De opemi wu ade besam nyame nkum.
Amen.
Na yi ase enya nyu ase. Sa na me boma. So obi otan obi ano. O na yi ase nya tan. Nsuo nto wa na yi ase.
Amen.
Me man krofo enko jam no. Eyi na sensei.
Amen.
Amen. Well, thank you for joining me. I'll see you again 5 p.m. for our divorce discussion. God bless all of you. We'll have a discussion at 5. Please follow me. Remember, you can follow me on Facebook as well. Go to my YouTube and subscribe on YouTube. Let's build a family. I like to share. Yes, my wife is not smiling because go and sleep, honey. She knows I sleep only 2 hours or 1 hour 30 minutes. I'll go and sleep for you. Okay. Thank you for your support. Good night. Good morning. Good afternoon. Take care of yourself till I see you again. Bye bye.
Bye bye. Bye.
Well, I thank you all very much for being here. It's a good thing to know how good it is to be part of my service, Charlie.
I hope you can hear the sound of what I'm chewing. It's nothing but it's ginger honey chips. Ginger honey chips. Now in the United States of America, everywhere you want, 862-215-2007. You can chew it like this, or better still, put it on your cocoa, rice water, oatmeal. You can put it in your akpadashi, your whiskey, your brandy, anything you want to put it on it. It's so nice. So nice. Oh my God. Ginger honey chips, 862-215-2007. 862-215-2007. It's your ginger honey chips. Get one for yourself. $10, free to go. Enjoy yourself. Thank you.